Okay, we are back. Welcome, everybody. I'm here with Chris Irizarry. Did I say that right?
That's right.
Okay,
Yes.
all right, I love it.
Perfect.
And Chris, you are with who?
The Department of Health and Welfare,
Okay.
and then kind of breaking it down further, the Division of Public Health. Within that, the Bureau of Rural Health and Primary Care.
Okay, very cool. And so are you here to talk to us about tanks today?
A little bit, but primarily we'll talk about a little bit about advanced care planning and the new Idaho Healthcare Directive Registry.
Chris was in the military and drove tanks, so we were just talking off camera about his experience there. Very cool. So we'll have to talk about that another time.
Absolutely.
But for now, thanks, Chris, for being here. Glad to have you. Thanks for your preparation. Looking forward to hearing from you today.
All right. Thank you so much.
Absolutely.
So my name is Chris Irizarry. I'm the program manager for the Office of Healthcare Policy Initiatives. In my team is Cynthia Herrera, who is the health program specialist, and then Jennifer Baker, who's a health program manager. And within our team, we manage the Idaho Healthcare Directive Registry. Again, we operate within the Bureau of Rural Health and Primary Care. Prior to that, Justin mentioned that I was a tank driver. So before I got into public health, I spent just under 24 years in the Idaho Army National Guard as a full-time soldier. I was a tank commander, starting from the bottom as a tank driver and kind of went up from there into both Iraq and Afghanistan. Once I retired, I took a year off and worked on my MBA, and then jumped right into public health after doing some volunteer work in the Nampa community. Just a quick disclosure statement. There's no financial relationships. All right, so no surprise, life is unpredictable. So as part of that, some of the questions you might ask yourself, are you as prepared as possible for an emergency situation? Is your roadmap for healthcare treatment ready in case of a scenario where you are unable to speak for yourself? And do you have loved ones or friends that are lined up to speak on your behalf to ensure that the things that you want in that type of situation are actually going to take place? And more importantly, do they know what your medical decisions are? So the Center for the Study of Aging at Boise State University conducted a survey that showed only 14% of those surveyed have actually spoken with a healthcare provider about their end-of-life care or advanced care planning. More so, there was 59% that felt that it is the provider or the healthcare professional's responsibility to kind of drive that conversation. So Idahoans aren't necessarily either thinking or planning for their end-of-life care or some of these situations. More notably is the fact that a lot of healthcare providers feel that it is the individual's responsibility to kind of begin this process. Always more than willing to help, but they need to kind of drive that that process. So we'll quickly talk about advanced care planning, what it is, how to get started, and what a healthcare advanced directive is, a physician orders for scope of treatment or a post form, what those are and the difference between the two, and then what the Idaho Healthcare Directive Registry is, and then how you can find additional resources. All right, so what is advanced care planning? The easy answer, you're planning for your care in the future. If there's a medical emergency and you're unable to speak for yourself, you want to ensure the healthcare treatment that you want is consistent with what your papers, your documents say. It doesn't just pertain to one age group. At any age, a medical crisis can leave you too injured or ill to make your own decision regarding health. So the recent pandemic is a perfect example and a stark reminder that advanced care planning is a very important process. And one day you can be perfectly healthy and the next day you're not. So on a personal level, I had my brother and his wife were involved in an accident this last July. And unfortunately, his wife was left in a coma. And that was some of the first questions that came up was, what does her healthcare directive say? And fortunately, she was able to recover. But one of the first things that once the recovery process was over, my brother and I sat down and worked through advanced directives. So advanced care planning, it involves learning about the types of decisions that might need to be made, the different scenarios where a decision needs to be made, and then the preferences that you'd like, and then actually documenting those preferences. All right, so advanced care planning steps. Some of the things you want to consider is how you want to live, what things are important to you that you want to continue to be able to do. Who do you trust to understand what your wishes are and are willing to step up and make those decisions for you? So the Advanced Healthcare Directive, it is for every adult aged person. I like to call it the crown jewel of advanced care planning. It consists of two parts, the durable power of attorney and the living will. All right, so a durable power of attorney for healthcare is a document that allows you to name a primary and then multiple alternate persons as your healthcare agents. And those are the individuals that are responsible for standing up and speaking on your behalf, ensuring that your decisions that you made regarding your medical treatment are being adhered to. So the second part of the advanced directive is the living will. And this is where you're actually going to document those choices about some of the life-sustaining medical treatment that you'd like. You can even go as far as I've seen somebody note that they want to be wearing their favorite slippers with classic rock playing in the background. So within reason, of course, you can really get detailed about what you want. All right, so the new pregnancy option, and I kind of get a lot of laughs about this one. I spoke with somebody, a 92-year-old man, for about 20 minutes, and he convinced me that he was never going to get pregnant and this wasn't going to be an issue. And so to kind of talk about this a little bit, there was a statement in the previous state template that said, if I am diagnosed as pregnant, my instructions regarding medical care shall have no force during my pregnancy. Essentially, there was not a choice to opt out of this. And this meant that a pregnant woman could be kept on life support, regardless of her documented decisions. Just last year, there was a suit that was filed against the state, whereas the Idaho Supreme Court ruled that forcing life support on an unwilling pregnant woman violates their constitutional right of consent to refuse unwanted life-saving medical treatment. Essentially, the state made the change, and there's now special provisions regarding medical care in a situation where a pregnant woman may become incapacitated. So as previously mentioned, an advanced directive is for every adult. A physician orders for scope of treatment or post form is not. The post form, it's a co-signed medical order, so it's signed by the patient and the healthcare provider, whether it be a physician assistant, or nurse practitioner. It kind of gives the patient more control over their care by specifying the types of medical treatment they want to receive. It translates a person's wishes from their advance directive into a medical order. And to kind of go on a little bit more about that, a post form really is designed more for somebody that is maybe suffering from a chronic illness or is a little bit closer or nearing their end of life. So this is one of the reasons that we actually don't have this form available on our website. We can certainly provide it. However, we were receiving a lot of post forms that were filled out incorrectly, or there wasn't a doctor's signature. A lot of individuals just assumed that it was part of advanced care planning and they had to have it. Moving on, again, just talking a little bit about the post versus the advanced directive. Generally, here is where I provide a little bit of a Q&A, a question just saying, if emergency medical services are called to resuscitate a patient and are shown a copy of an advanced directive, and it says clearly that the patient does not want to be resuscitated, will the EMS resuscitate that patient? A lot of people, when I ask them this, they say, well, of course, it says right there in the document. However, EMS personnel will not resuscitate, will resuscitate that patient because they're not doctors and they do not have the benefit and protection of having two physicians on site certifying that the patient's death is imminent regardless of the use of artificial life-sustaining measures. So the post, in a sense, I like to say is for use at home, and then the advanced directive at the facility. One is not better than the other per se. They're both kind of work together just in different scenarios. All right, these registry specific forms, it's by no means a requirement to have your advanced care planning documents on the registry. It's just a service that the state offers. It's a free service. However, if you want to register your documents, we just need to know the patient's information. So that's going to grab your basic demographics, name, birth date, address, phone number, stuff like that. That's the registration form. The only time this really isn't needed is if you as a patient go in and create your own account on your own. You wouldn't need to worry about completing this form. The other form is a web form. It was designed primarily for the transition of registrants from the Secretary of State's office and their registry over to the Department of Health and Welfare. And they could provide their information here, and we would essentially create their account and link them to those merged documents. However, we still, although that transition has been completed, we still have that web form available because somebody can easily go on there, put their information in, and still request that we create their account. All right, the advanced care planning webpage, this is created by the Department of Health and Welfare. It's a page that we manage. There's additional resources on there from describing the responsibilities of a healthcare agent, the advanced directive planning worksheet, where you can identify some of those, your agents and some of those wishes and desires for treatment that you want. And then there's frequently asked questions, as well as a direct link to the registry homepage. All right, so the Idaho Healthcare Directive Registry, this is kind of the meat and potatoes, if you will. I like to say it's not everything. It's a a tool that's available for advanced care planning. So how this came about, the registry was originally stored at the Secretary of State's office. Essentially, people could send in their advanced directives. Those would be scanned and uploaded to this registry, and that was kind of the end of story. There was limited access as far as providers go. So, excuse me. So healthcare providers had to have that patient's filing ID card, a physical, almost credit card item, in order to access those documents. Thank you so much. So legislation determined that they wanted to make some changes to the registry. They moved the registry from the Secretary of State's office over to the Department of Health and Welfare. And they had a few requirements. Some of those requirements was online access for both healthcare professionals and for the patients. It had to be accessible on a 24 hours basis, 7 days a week. However, you could still either register your documents online, or you could mail in handwritten documents as well. And then the big part of it was incorporating the advanced directives and post forms that were previously registered with the Secretary of State over to this new registry. That way, there was you didn't have patients starting from scratch. So in October of just last year, there were over 53,000 accounts and documents that were transferred over. And we went live with the new registry. All right, and actually to kind of skip back real quick. So one of the key things with the registry, again, it's a place where somebody can store their documents as it relates to their healthcare treatment, their advanced directive and post form. I like to tell the story of a woman that I spoke with. She was 102 years old. She had outlived her kids and some of her grandkids. And so she actually didn't have anybody that she could share this document with. And so for her, this was a perfect situation where she can put these documents on the registry, and authorized healthcare professionals can access those documents in case of medical emergency. All right, so just a quick recap. So we know the importance of advanced care planning. We know the forms that we need to complete. We kind of have a good idea about what the registry is. And so now we can kind of put it all together. All right, so this is just a glimpse of what we refer to as the patient portal. So as a registrant, this is the page that you would go to log into your registry account. It does say at the top, it's managed and created by Vinca Health. And so some of the emails and things that person would receive have that attachment of Vinca Health to it. One of the things I like to say is that the registry is kind of two-sided. So this is what the patient would see, and this is what a user would see. And when I say user, I'm referring to a healthcare professional. Myself, when I go to perform maintenance on patient accounts, this is how I log in. And so one of the things we can do is, and are currently doing, is working with healthcare facilities and even attorney offices and providing them with access to the registry so they can log in and search for their patients or their clients and upload pre-existing documents or create new documents for them. All right, and not going too in depth into some of the functions of the registry, but as a user, which I think the majority of the audience could be, it's as simple as typing in somebody's name, clicking the search button, and then it pulls up the search results. It shows their date of birth, their name, and gives you a chance to kind of make sure that is the person that you want to see. All right, and once you open that up, you have the patient dashboard. And here's where you have 3 separate categories. You have a post category for the post form, the advanced directive, and then there is something else on there that says additional documents, or it's not something we really use, but it's available. If the patient wants to put something in there, we certainly won't say anything about it. But keeping that separation of documents is very helpful. One of the things I want to point out is, hopefully you can see that it actually is stamped on there that that is the current version of that document. So if this patient were to go in today and create a new one, the one that's marked current will actually get stamped as prior, and then the new one will be stamped as current to ensure that there's version control. So the user roles within the registry. So there's one specific one for individuals that are authorized to sign a post form, and that they're going to be labeled as signers. So again, that's going to be your MD, OD, physician assistant, and nurse practitioner. And that role is reserved just for those individuals. They can actually go in and create a post form, an electronic version. The patient can sign there, and then the provider can go right behind them and sign that document. Other roles are probably the most common is the preparer role, and that's the individual that can go in and prepare a post form. They can actually create an advanced directive for the patient, and they can kind of forward that information on to the signer. So gaining user access, it's as simple as just shooting us an email, giving us a phone call saying, my facility would like access to this. How do we do it? And we'll send you a form. It's quick and easy, just capturing your name, email address, and the role that that individual holds. From there, we create the user account. The user verifies their account and creates a password. And from there, they have access and the ability to create, search, view, and upload documents. All right, so hopefully I didn't run through that too quickly. One of the things I wanted to quickly point out, though, we have some frequently asked questions when the registry first came up. The biggest one, do we still get the filing ID cards? One of those, so with the Secretary of State's office, they actually sent out, like I mentioned earlier, that kind of credit card type card that was used for handing to a hospital, and they could use that card to look up a patient. Because healthcare providers have access to the registry now, we actually don't need to have that form, and they don't need to have that form either. And then, of course, there's no cost to the registry. That was another top question.
Chris, thank you very much for that information. And I just want to let you all know what an incredible lift this has been for the Department of Health and Welfare. And there's a lot of people around that lift. I was able to participate in that, but many, many, many people that have helped to make this such a wonderful resource for not only our consumers, but also all of our healthcare organizations across the state. So Chris, we have some questions. Can you speak to the kind of conversation that would best facilitate completion of an ACP document? And I might join you in some of these, answering some of these.
Yeah, so just to kind of get the conversation started, that's, you kind of have to identify what it is that you want to do and approach your healthcare provider and ask them about some of those questions. I know one hospital specifically during their annual wellness exams, they will actually speak to their patients about creating an advance directive and checking to see if they even have one. So it's, I think, something that could be brought up at any time when speaking with a provider, whether it's an annual visit or something like that.
I want to stress, we're all healthcare providers in this session, but I want to stress the importance of letting the consumer know that they don't have to wait for us to have that conversation. They can go out and take advantage of these wonderful resources on the Department of Health and Welfare site, get that information, and start that conversation with their family. So many times we see patients that have completed an advanced care planning document and not had any conversations with their family or their friends. And then the worst thing is when the durable power of attorney for healthcare gets called up and said, hey, and they didn't know that they were designated as this. They don't know anything about the advanced care planning document. So it's really important to stress to your clients, to your patients, that this is not an individual event, but this is a family or friends event where you want to make sure the folks around you that are in your inner circle have that information. I think the other thing I'd say too, with regard to having this conversation, is Honoring Choices Idaho was something that we had in place over the last couple of years, and actually probably more than a couple of years.
Right.
And one of the things that we got set up and is still around today across the state in different locations is we have facilitators, advanced care planning facilitators, and these folks have been trained in how to have these conversations because it is a skill set that when you have those skills, you can have a more productive and more focused conversation. And there's two levels of that, as Chris has mentioned, with regard to the advance directive, which frankly, any adult should have. So a challenge to you all, maybe this is a 2-week challenge. If you don't have an advance directive yourself, please consider going out on the Department of Health and Welfare site and getting that started for yourself. And if you know that you have adult family members who don't have that, I encourage you to do that as well. So these facilitators across the nation or across the state, they are having these conversations, but they go one step further than the advance directive. If this person's a person that has chronic disease, if this person that has a life-limiting situation, then that's where we start talking about, is the post a valid document for you? Is it something that's going to be something that will help you out? And it's unique. I want to stress again what Chris said. There is a distinct difference. Everything falls under the umbrella of advanced care planning documents. So if you can kind of mentally picture an umbrella, underneath that umbrella, you have advanced directives. And underneath advanced directives, you have the living will, durable power of attorney. And then over here under that umbrella, you have the post document, which is actually a medical order. And that is honored throughout the continuum of care. So whether you're in your home, whether you're in a clinic, whether you're in a hospital, whether you're in a subacute or long-term care facility, the post document is something that is recognized. So next question. How safe are the documents in the registry, Chris? Are they just something anybody can access?
So absolutely not, of course. So it is a cloud-based server, if you will, that the documents are stored on. They have plenty of firewalls and things like that. It is not something that you can just log in and search for somebody on there unless you have access to it. So there is a feature in there called My Shared Circle, which as a patient, I can add anybody that I want to view my documents in my family or friends. I can add them. They're given their own login. They can log in and view my documents. They can't make any changes. So everything that I put on there is it's visible to them. One of the things that I'll point out is don't want to add any healthcare professionals or providers to that. Just because adding your doctor, you might have, that doctor is seeing a couple hundred patients, then he's getting a couple hundred invites and certainly doesn't have time for that. The other reason is he can be given access to the registry anyway, so he can view those documents.
Yeah, one of the things that you mentioned, and I think it's important for our audience to hear this, so that as they talk to their clients, their patients, they can kind of help them navigate this successfully. You talked about some of the submission errors that happen, like they submitted their document, but it didn't get accepted. Nobody likes rejection.
Right.
So how do we deal with those? And what is the most common submission errors that you see?
So with an advanced directive, those ones are a little bit tougher because really based on Idaho code, that document requires a signature and a name and a date of birth. So although we do try to reach out individually to those persons and kind of let them know, oh, there's some additional forms that go with this, that would probably be the most common one. It's just there's different versions of the form. So it takes us a little bit of time to go through and make sure what they actually want is what is actually put on there. With the post form, that was something I mentioned. The biggest one is not having a healthcare provider's signature on there. Again, with those, we'll actually reach out to either the facility to try to get that signature, or we'll go to the patient themselves. But either way, whatever it takes, we're willing to take that extra step. I don't know how many letters I've written, personalized letters. It's not a big templated letter because everybody's situation is different, but letters, emails, phone calls, we'll again go out of our way to get those documents up on the registry and accessible.
That's excellent. So I know that you and your team have been involved in some outreach efforts to provide education, not only to healthcare professionals like we all are, but also to consumers. Can you talk a little bit about that? And if folks that are on in the session today, they have some needs that they would like, can you also address how they could reach out and maybe schedule some time to have you come teach their
Absolutely.
folks?
And so I'm actually going to skip a slide real quick just to our contact information. So one of the things that we did do in the beginning was worked on an outreach plan to kind of go, obviously going to the bigger facilities is easiest and then kind of working our way down. We are working on some how-to videos, and it's both for providers and for consumers. And it really is a step-by-step 1-2 minute video where they can see how to create their account if they want, how to create their documents, things like that. As far as outreach goes, we have been working with some facilities to do presentations. I think just a couple of weeks ago, I had 4 presentations, whether it be, a senior living facility or a healthcare facility. We're always willing to come out and present to somebody. So we're still kind of, it's still, I know it's been around since October, but it still feels really new to us. And as we've kind of worked the bugs out, we're continuing to work through the outreach process. I know, again, recently we sent out postcards to healthcare providers specifically, letting them know this is how they can gain access. We'll be sending one out to attorneys, letting them know the same thing. And then another one to healthcare organizations, just saying it's here, please use it. Anytime we get documents from the Secretary of State, because they still receive them, we of course respond to the patient, but then we also respond to that facility and let them know, hey, stop sending stuff over here. This is the new place. Here's the new forms, things like that. So we try to stay pretty active on outreach and response.
Change is a difficult thing sometimes.
Yes. Unfortunately, it doesn't happen overnight.
You know, I was thinking what you just said about October. I can't believe it's almost been a year, next
Right.
month. And so this has been awesome. I also know that we have some questions that have come in from our participants. So Ruth, you want to let us know what those are?
Sure. Lisa has a question. What happens if a preparer fills out a form, but the individual's provider is not a user and doesn't have an account?
Okay, so they can, I'm assuming they're referring to a post form, but so in that case, I certainly would recommend that the provider gain access to it, and only because essentially that form will just sit in a pending status. So it won't be applied to the account. It'll just kind of hang out there until an authorized user can actually sign it. If there's a situation like that, another option, they can print the form and then, have the provider hand sign it, and then that preparer can physically upload the signed document.
And I want to just clarify too, when they say preparer, I think they're talking about somebody who has that preparer role in the new registry. And Chris is exactly right, but I want to also clarify that the post document in its blank form should never be given to a consumer. This is not something that, like an advance directive, where we say, here, this is something you can fill out with your family. It should always be a trained facilitator, or it should be a provider, an advanced practice nurse, a PA, or a physician that is having that post conversation with them and filling that document out.
Okay, thank you. Lindsay has a question. She would like to know more about how many users have joined since the registry was launched. And is there a statewide or diverse healthcare provider representation? So do you have a sense of how many are coming from PCPs? How many are coming from hospitals, long-term care facilities?
So I could definitely find that information out, because it is broken down by facility, and then of course we can identify what that type of facility is. Gosh, to kind of throw a number out there, there's probably at least 100 providers that are healthcare professionals that and attorney offices that have been added. Some of them we tell them, hey, you can have this access, you can do this, and we've had some come back and say, no, it's fine. We'd just rather email them in and let you guys do it. And so they're not necessarily concerned with that access. So it does happen, but I'll actually go back real quick and put our information up there. If it was Lindsay, I believe, you can certainly send us a quick email, and I'll follow up with you. I can break down some of that, the data that we receive. We receive it each month. So I can give you anything you'd like to know regarding the registry, of course.
We know that there's some reticence to having these kind of conversations. And we also know sometimes in the state of Idaho, there is reticence to share information with something that looks like the government. From your perspective as someone sort of behind the curtain, can you speak to the assurances that are in place that, I mean, you've already talked a little bit about the safety, but can you, if there is an answer that people could provide when they're having conversations with people who may be reluctant to put their decisions on paper and then have them registered, what would you offer?
That one is kind of tough. I would say it's not, I know it is a state government site, but it's not used for tracking purposes or anything like that. And maybe I'm missing the mark on the question, but it's just used as, we don't, when people add their email address or their personal information, we don't use that and sell it to a third party for advertising or anything like that. Yeah, that one, I can just say based on our terms and conditions that are in there, I don't know that, I'm not sure if you have something a
I
little bit
do.
better.
I think that obviously this isn't, the registry is not the only thing. If people are adverse to putting their information in different places online, an example is banking online is such a prevalent thing these days. There's a lot of personal information that's in there. But I think also with regard to our health information, that if you're uncomfortable putting it in the registry, we certainly like the registry because that registry helps us to provide each of the consumers that are getting healthcare with hopefully a seamless, goal-directed healthcare experience. And so if you don't want to, or if your patients or clients don't want to participate in that, then there's the option is just do it, but have it done in paper. And make sure that you've provided that to the key people that are providing your healthcare in your life. And you don't have to use the registry. But again, I would say that I have a very high confidence that the registry is there. Their sole reason to be there is to help you and your clients to be able, and your patients to be able to get goal-directed care. That's why they're there. All right. Well, Chris, that was awesome. And thank you so much for being here. Thank you to our participants for the wonderful questions. And again, if you have any questions or comments for Chris, you can reach him at the information that you see on the screen there today. And thank you so much for everything. We're going to go ahead and break for lunch at this time, and we will resume our sessions following lunch. So thank you, everyone. Thank you, Chris.
Thank you.